Hello, and welcome to Healthy Lifestyle Tips. Today, we're going to talk about a topic that many people find fascinating: tattoo removal. Tattoos have been a popular form of self-expression for centuries, but what happens when you change your mind and want to get rid of your ink? How does tattoo removal actually work? To understand how tattoo removal works, we need to first understand how tattoos are created. A tattoo is made by injecting ink into the dermis layer of the skin using a needle. The ink particles are too large for the body to absorb, so they stay in place permanently. Tattoo removal works by breaking up the ink particles in the skin so that the body's immune system can remove them. There are several methods of tattoo removal, and we're going to explore the most common ones. 1. Laser tattoo removal. Laser tattoo removal is the most popular and effective method of tattoo removal today. The process of laser tattoo removal involves using a high-intensity laser beam that is directed onto the skin in the area of the tattoo. The laser beam delivers a concentrated burst of energy that is absorbed by the ink particles present in the skin. The absorption of the laser energy by the ink particles causes them to heat up rapidly and shatter into smaller pieces. These small pieces of ink are then recognized by the body's immune system as foreign objects and are gradually eliminated from the body over time. The process of breaking down the ink particles into smaller pieces is known as photothermolysis. The number of sessions required for laser tattoo removal varies depending on several factors, including the size, color, and location of the tattoo. The laser tattoo removal process is generally less effective on darker ink colors like black, blue, and green, which absorb more light and require more sessions to remove. Lighter ink colors like yellow and white may be more difficult to remove because they reflect more light and do not absorb as much laser energy. The number of sessions required for laser tattoo removal can range from a few to several sessions, spaced several weeks apart. This spacing is necessary to allow the skin to heal and the body's immune system to eliminate the broken down ink particles. The spacing also allows the tattoo removal professional to assess the progress of the tattoo removal process and adjust the laser energy as necessary. The process of laser tattoo removal can be uncomfortable, and many patients report feeling a sensation similar to that of being snapped with a rubber band. However, topical anesthetics and cooling devices can be used to minimize discomfort during the procedure. 2. Surgical excision. Surgical excision is a method of tattoo removal that involves physically cutting out the tattooed skin from the body and then stitching the remaining skin back together. This method is typically used for small tattoos because larger tattoos would require a much larger area of skin to be removed and therefore could result in significant scarring. Additionally, surgical excision is not recommended for tattoos in sensitive areas such as the face, hands, or feet, as these areas are more prone to scarring and may also be more difficult to properly close up after the removal. While surgical excision can be an effective method for removing tattoos, it can also be a painful and invasive procedure. Local anesthesia is typically used to numb the area being treated, but patients may still feel some discomfort or pain during the procedure and during the healing process afterwards. Additionally, since surgical excision involves cutting into the skin, there is always a risk of scarring and infection, which can further complicate the healing process. Despite its risks, surgical excision may be a good option for individuals who are unable to undergo laser tattoo removal due to skin type or other medical conditions. It is important to consult with a qualified medical professional to discuss the risks and benefits of this method and determine if it is the right choice for you. 3. Dermabrasion. Dermabrasion is a tattoo removal method that involves the use of a high-speed rotary tool to remove the top layer of skin, including the tattoo. The tool used in dermabrasion is similar to a small sanding device, which rotates at a high speed to remove the outer layers of the skin. This process is similar to the way sandpaper is used to smooth down rough surfaces. During the dermabrasion procedure, the area to be treated is first cleaned and numbed with a local anesthetic. Then, the high-speed rotary tool is used to remove the layers of skin that contain the tattoo ink. This process can be painful, and some people may require additional pain management techniques, such as a topical anesthetic or pain medication. While dermabrasion was once a popular method of tattoo removal, it is not commonly used today due to the risk of scarring and other complications. This method can cause damage to the deeper layers of the skin, which can result in scarring and discoloration. In addition, dermabrasion is less effective at removing tattoos than other methods, such as laser tattoo removal. Despite these risks, dermabrasion may be a suitable option for some people, particularly those with smaller tattoos or tattoos in less sensitive areas. It is important to speak with a qualified professional to determine if dermabrasion is the best option for you. 4. Chemical tattoo removal. Chemical tattoo removal is a method of removing a tattoo by using chemicals to break up the ink particles in the skin. This method involves applying a chemical solution to the skin, which is then absorbed into the skin and breaks down the ink particles. The solution typically contains acid or salt compounds that break down the ink particles over time. One of the advantages of chemical tattoo removal is that it can be less expensive than laser tattoo removal. It's also a good option for people who cannot tolerate the heat or discomfort associated with laser treatment. However, chemical tattoo removal is generally less effective than laser tattoo removal, and it may take longer to achieve results. The success of chemical tattoo removal also depends on several factors, such as the size, location, and color of the tattoo. Some colors, like red and yellow, are more difficult to remove than others, and may require additional treatments. Another potential drawback of chemical tattoo removal is that it can cause scarring or discoloration of the skin. This is because the chemicals used in the process can be harsh and may damage the surrounding skin. In some cases, the skin may become irritated, inflamed, or infected. It's important to note that chemical tattoo removal should only be performed by a qualified professional who has experience in the process. This ensures that the chemicals are used correctly and that the risk of complications is minimized. No matter which method of tattoo removal you choose, it's important to remember that it can be a lengthy and often painful process. You should also be aware that some tattoos may not be able to be completely removed, and scarring is always a possibility. If you're considering tattoo removal, it's important to speak with a qualified professional who can help you decide which method is right for you. Thank you for watching this video on tattoo removal. If you enjoyed it, please consider subscribing to Healthy Lifestyle Tips for more informative videos on health and wellness.